Testosterone replacement for women reduces symptoms of menopause. It helps maintain weight and is protective against heart disease and breast cancer. Dr. Charles Moak is here to talk more about how you may be tested for it. We've got him from Allure Medical Center. Excited to have you here. You're passionate about this one. You even wrote a book about it.
Yes. The book's called Testosterone Strong Enough for a Man but Made for a Woman, and the history of hormone replacement in menopause. We're talking principally by menopause, which is defined by no period for a year, or perimenopause, that time around menopause.
Right.
And traditionally we were treating this with estrogen, which worked and made sense. And then about the late 90s, we started using synthetic drugs to treat this, treating it like a more of a medical condition versus a normal like loss of your hormones.
Yeah.
And then we found there was maybe some issues with some of these stronger, aggressive synthetic estrogens and progestins. And this led to women basically and their doctors abandoning the use of hormone replacement therapy for women with what we call vasomotor symptoms or menopausal symptoms, hot flashes, night sweats, weight gain, decreased energy, mental fogginess. And that led to a whole rethinking of how we're approaching this. And we think about testosterone as being a male hormone. I have more testosterone than a woman, about 10 times more, but a woman has about 20 times more testosterone than estrogen when she's 20 or 30 years old. We don't think about it because we think of estrogen, but all of your estrogen comes from your own testosterone.
Oh.
And we found that in the last 20 years that testosterone replacement not only improves all symptoms of menopause, helps with weight, energy, mindset, but it also reduces risk of breast cancer by between 40 and 70%, remarkably breast cancer protective. And I'm not bad-mouthing estrogen. Estrogen is cardiac protective as well. So we use typically testosterone and estrogen together. This reduces symptoms of menopause, very breast cancer protective, very cardiac protective, heart attacks, strokes, and it improves what we call vasomotor symptoms. Those are the hot flashes, night sweats, mental fogginess. Additionally, we have a big issue with our weight. We're concerned about our weight, and that's the most common things women complain about when they hit menopause. I'm putting weight on, what's going on?
Even if you're not doing anything different, it's, which is what's so frustrating.
Yeah, so as your testosterone drops, so do your estrogen and other hormones, and weight tends to gain. But when we go back on testosterone replacement, you can either lose weight easier or it actually does favor weight loss and weight maintenance. So testosterone, breast cancer protective, cardiovascular protective, weight protective, but also just feeling better, feeling normal. And when you are young, you're making all kinds of testosterone. Hit menopause, it's pretty much gone. It's gone. In fact, you only need to check the blood test. There's no way you're making a lot of testosterone once you're in menopause. And we replace this, you can replace it long term, live a healthier, longer, more fulfilled life.
I love it. This sounds like too good to be true. How do we replace it?
So typically we use what's called a pellet. The pellet's about the size of a piece of rice, and it goes in the skin, usually in the upper buttocks. It doesn't hurt. We numb you up for it, slide a pellet in. And the dosing is really easy. It's basically 1 milligram per pound of body weight. That's very consistent. In certain circumstances, we use estrogen as well, about 1/20th the dose. And that's based on if you've been in menopause less than 10 years, because then it becomes very cardiac protective. So we see that plaques don't develop as quickly, heart attacks are much less likely, about 40% reduction. So that's the combination, and you can talk to one of our providers about it. Basically, there's not a complex evaluation. You can have maybe had labs done at your doctor's office in the past, but it's really not necessary because when your ovaries are no longer functioning, you're not making the sex hormones anymore.
How will you know? Okay, so we came in, I got my pellet in. When will you start to, maybe feel different? How will you know if this is in fact going to work for you?
It's almost like clockwork, about 2 weeks.
Okay.
So 2 weeks after, sleep gets better, energy's better, hot flashes are gone, less sweaty. So it is pretty much like a switch got turned back on.
That's amazing. That would be like great. Okay, now I'm fun again. Talk to me, about cost and how people right now watching can see if they need to go by and try it.
Yeah, it's a great question. So insurance doesn't cover this. Now it is FDA approved for women. It's been FDA approved for 70 years.
Right.
Actually, the first FDA approval was for breast cancer, for treatment of breast cancer.
Yeah.
But the cost is about $400 every 3 months. So it's about $1,200 a year. There's not much else over and above that. Some people might do blood work or labs. Not really necessary. We're kind of chasing something that's not necessary to chase.
Right.
It's symptom-based. Once the symptoms are resolved, that's your proper dose.
That's where it is. Okay, if this sounds like more that you would like to talk to, go to alluremedical.com. Read more about it. You can get the book. It explains everything. Get set up today. Dr. Moak, you make it make so much sense. We appreciate you.
Thank you.